in today's medical moment. Stem cells have been around for a while now with claims of helping patients heal faster. But is it really true? Marty Salt has details on a new study focused on rotator cuff surgery.
David Mannion is an active fisherman, golfer, and a sculptor. But 3 years ago, he was sidelined by pain in his right shoulder.
Pretty much shut me down. I like to take care of myself, and I like to take care of the people around me. I definitely was not able to do that.
David knew he would have to get rotator cuff surgery, but there are some risks.
Even though we repair the tendon, we stitch it back into place, about 20% of the time, it may not heal.
Which means patients can still have some functional issues, pain after surgery, or even require a second surgery. That's why Dr. Verma wants to see if he can harness the body's own healing power to heal better and faster. In a trial of rotator cuff surgery patients, he collected and injected stem cells into half of the patients during surgery, then looked at MRI scans a year later.
In the group that got the stem cells, we could see a marked improvement in the appearance of the tendon compared to the group that did not get the stem cells.
David participated in the trial and was part of the group that got the stem cells. His recovery went so well, he decided to do the stem cells again when his left shoulder gave out.
And it worked out really well for me last time. Can I do it again?
3 days after surgery, he no longer needed pain meds. And 3 weeks out, he's eager to pick up where he left off.
It's hard to stop me, actually. I'm told by my daughter and wife all the time, stop picking stuff up.
I'm Marty Salt, reporting.
And Dr. Verma says patients in this study use their own stem cells. He says their own is best, but if they have cancer or blood disease where they don't make cells normally, a donor could be considered in the future. The stem cell treatment is still experimental, so insurance does not cover it.